In the last clip, we discussed some of the differences between those patients who had to stay behind for recovery, as well as those who were considered outgoing patients, and what kind of procedures or surgeries, if you will, that were considered outgoing patient treatment. Of course, we talked about bullet extraction, and of course, depending upon the severity of the wound, you might be sent home as soon as the bullet was extracted and you were bandaged, or when it came to the guillotine amputation, they go ahead, they cauterize the wound, bandage it up, and you were sent on your way. And also, it's interesting to note how, depending upon what hospital you were in and what herbs and certain medicines they had to make the patient as comfortable as possible, once everything was all said and done, you could quite possibly be sent home in a delirious, groggy state. But this was just for the outgoing patients. Obviously, when it comes to people who are suffering with severe cases of dysentery, ague, and so on and so forth, other such diseases at the time, consumption was a big one. Or, of course, if you had to deal with the horrors of going through an amputation or trephination, then you would have to stay behind, and from there you would be sent from the operating room to the recovery ward. Now, the interesting thing about these recovery wards is that when it came to the American hospitals, they were stuffing their beds for their patients with a variety of materials, ranging from corn husks to pine straw, animal fur, human hair in some cases, and of course feathers. And they're not cleaning this out before they put it into the bedding, mind you. So you could quite possibly be getting ready to lay down, and you'll find that there would be a lot of creepy crawlies hiding out in the bedding who are waiting to feast as you are trying to rest and recover. But as you might have guessed with the Spanish hospitals, there was an exception to this rule, and they simply went ahead and stuffed their bedding with Spanish moss, which was readily available, hung from many trees, some of them, of course, just outside of the hospitals. And they would take down the Spanish moss and use it for their bedding, which does present a problem when you realize that Spanish moss has chiggers. But the Spaniards had come up with a very simple solution to solve this problem, because after they had harvested the Spanish moss, they would then boil it until it practically turned black. And this let them know that the Spanish moss was now sterilized and the chiggers were all dead. And then they would hang it on the lines to let it dry, and once it was dry, then and only then would they put it into the bedding. But of course, this stuffing was only one and done. Remember, the Spaniards were very clean and they stayed up on their hygiene and sanitation. So for once one patient was removed and another one was getting ready to come in, they would take that old bedding out of the linen, burn it, and then they would boil and clean out the old linens before they would put it on the bed, stuff it with new Spanish moss for the next patient coming along. Now, some patients who received a bed, they received beds that were definitely a little bit more on the comfortable end of things, but that's because they had suffered through more severe surgeries, say amputations, if you will. These people, they were not able to go out and venture to the latrine in order to perform their pollutions. So in that case, you would be given a bed that had a hole in the center of it, which would grant you easy access to the chamber pot underneath. And in some cases, if you were in that bad of a state, you would be sent to the isolation ward, wherein you would not only receive a bed with a hole for access to the chamber pot, but you would also have a privacy screen set up so you could, well, as I like to put it, so you could pass legislation in peace and comfort. But while they're being in the ward, they are being treated with a variety of things to get them right back on track, and the physicians saw to this in a very meticulous manner, those of which we'll have to discuss in our next clip.